When I first saw that there was an opening at a medical clinic for refugees in Tennessee, I was honestly a bit confused. If you had told me that Nashville was anything other than Music City, I probably wouldn't have believed you. Of course, I don't think that anymore. My name is David Lind. I'm a member of the class of 2018, and I spent this summer working at Siloam Family Health Center in Nashville, Tennessee. So Siloam actually started in 1991 after a group of members at Nashville's Belmont Church had the idea of integrating their faith with their medical background to start addressing the needs of the underserved in Nashville, especially those who seem to be falling through the cracks of the healthcare system. What started as a small, volunteer-driven primary clinic today has a staff of about 40, as well as hundreds of volunteers and many community partners. Siloam's providers see roughly 5,000 patients each year, the vast majority being immigrants or refugees. Despite its rapid growth though, Siloam has remained true to its mission to provide whole-person healthcare to the uninsured throughout Middle Tennessee. My position as Health Literacy Coordinator focused on the refugee demographic of Siloam's patients. Although Siloam cares for the uninsured of all backgrounds, nearly 90% of patients are foreign-born. One of the first important stops that many refugee families make after stepping off a plane is actually at Siloam as part of the screening process. The refugees come from all over the world, including Iran, Iraq, Democratic Republic of Congo, Vietnam, Cuba, and more recently, Syria. The Health Literacy Program was organized in order to make sure that these refugees have a functional knowledge of healthcare basics in America. My role was to organize health classes that went over these fundamentals. For example, in many countries you would go to the hospital whether you had an earache or a heart attack. Here, obviously, we have separate facilities ranging from clinics and urgent care centers all the way to the ER. As a result, many of Siloam's new patients have found the classes to be very valuable in adjusting to their new life in the States. As a nonprofit clinic, however, Siloam relies fairly heavily on outside sources for funding, and the Health Literacy Program is no exception. In order to receive the grant to continue the program, Siloam has to demonstrate that individuals are in fact benefiting from the curriculum and that a certain number of families are participating in the classes. A large part of my role then involved coordinating caseworkers, volunteers, interpreters, and refugees in order to reach the goals by the end of the grant year in August. By the end of my time with Siloam, we had successfully exceeded these goals, meaning the program is all set to continue into the next grant year. Working at Siloam has been a truly invaluable experience for me, both as a student and as a person. In my mind, Siloam is a model organization in terms of incorporating medicine, faith, and compassion into effective global health advocacy, even from right here in America. Not only did I have the opportunity to develop my professional skills, but I also had the privilege of working under and alongside one of the most driven and compassionate clinical staffs in the state. I'm very grateful to the Center for Health and Well-Being, as well as to the PICS program for making this summer possible, and I'm excited to see how my time at Siloam will shape my future career.